Hello, everyone, and welcome to TuneIn. This is our sixth episode, and today we are diving into something new that is business intelligence. We are excited to have Kevin Espenschied, Vice President of Business Intelligence, joining us today. Kevin, welcome to the show.
Thank you for having me.
Great. We are so happy to have you, Kevin. Kevin, my first question to you is, in your view, where does BI have the biggest impact today? Is it clinical outcomes, operational efficiency, or financial performance?
Yeah, I think that's a great question. I think it shines a light on some of the opportunities that we're seeing today, particularly in the clinical space. So as I've worked in the data and analytics and business intelligence space in healthcare for a long time, a lot of the impact has been felt on the operational side of healthcare, particularly in financial performance as we think about revenue cycles, supply chain, kind of the blocking and tackling. Although, in my view, the soul of healthcare always resides in the clinical space. And what's exciting with some of the advancements that we've seen in recent years, particularly around large language models, is the ability to be able to impact the clinical space in a positive way. So I don't think that it's one particularly space of those areas. The way that we impact from a data and analytics business intelligence standpoint is different. However, the magnitude of impact is quickly changing from operational efficiency more to how do we drive clinical outcomes. I mean, the golden goose of healthcare for the longest time has been population health management and risk management. The tools that we're seeing come in place today that help drive positive clinical outcomes will be what ultimately drives the US healthcare system to accomplish the quadruple aim.
Oh, great. So we are anyways driving US healthcare with our expertise here at IKS Health. So my next question is, healthcare generates massive amounts of data. What's the biggest challenge in turning that data into something actionable?
Ooh, interesting question. I think we deal with a couple of challenges. Data silos still very much exist within healthcare. And it's whether it's siloed information based off of the system, be it a clearinghouse, EMR, EHR, a billing system. Those silos continue to exist. And as there's been a push towards data interoperability, some of those silos have broken down. We still have yet to fully break down those silos. The other, I would say, is around data cleanliness and turning structured, semi-structured, unstructured data into relevant insights. Ultimately, those two kind of work together. I think the other part of it that's been challenging as we work with data, I'm old enough and have worked in data long enough that the initial push was, well, we just have to be able to capture all of our data, get it out of paper charts, get it into electronic health records. That was the first step. And then it was, well, we now have all of this data in an EHR, in a billing system. What can we do with it? And that's been the subsequent step. And now that we have all of this volume of data, how do we distill out a lot of the noise and bring it into, give me the information that is contextually relevant at the point in time that a clinician or an administrator needs that information in order to make the best possible decision. So I'll give you an example. I was having a conversation with a surgeon this last week at IKS's user group meeting. And what we talked about was, he'll go into a surgical case and he has at times hundreds of pages of PDF documentation that lays out the medical history of this patient. And he's going, really, there's 3 or 4 paragraphs that I need to be able to read and understand in order to have a safe and clinically effective outcome. The problem is there's this massive volume of data, and at present, I've got an MA reading through it and highlighting for me and cutting and pasting up to the top of the chart, so I'm not digging through hundreds of pages by myself. The opportunity that we have, of course, from a business intelligence and data and analytics standpoint is how do we develop the muscle memory or the learning capacity, right? AI is great at sorting out patterns. How do we identify those patterns? And so it isn't a human-led process, but we can separate the really valuable insights and information from all of the noise and present that in the appropriate scenario to the appropriate contextually relevant individual.
Nice. So our data insights are helping clinicians take their decisions properly.
Yep.
Great. Moving on to the next question. What are some common misconceptions people have about data and analytics in healthcare?
Yeah, so I think the first is what I would describe as the magic wand misconception, and that just because we have the data somewhere that we can quickly retrieve it and structure it in a way that's going to be relevant. I mean, one of my favorite comics is XKCD, where the joke is like select star from magic table that doesn't exist. So going back to that idea of data silos or dirty data, I think the other one is data itself. Dashboards don't solve the problems themselves. Like no one ever solved a problem from a dashboard. They solve a problem because a dashboard gives them insight and information to be able to make a change. And so just having data isn't a strategic advantage. Having data and using that data to do something thoughtful, unique, insightful is where we see benefit come. And so this need for just like, we're going to have a BI team that solves all of our problems. No. Our team works collaboratively with other teams to be able to solve their problems and be able to give them the insights and information they need in order to make a good decision.
Okay, so even for the internal audience, we help with decision making, and even to our clinicians and surgeons and all out there in US healthcare, we help in decision making. Wow.
Yeah, like that is the role. It isn't just like that there's no problem again has just been solved by like a data set in isolation. It's about how do you use data to be able to support good decision making.
Great. Agree with it. Yes. Our next question is, how do you help your team connect metrics and models to real world decisions?
Yeah, so one of the things I tell teams consistently is the quality of our analytic is determined by its ability to answer the next question. And so as you're working with data, I love to go through an exercise that I call the 5 whys. And so if we see say a denial rate is increasing. Well, why is it increasing? Oh, well, Blue Cross Blue Shield went from a 5% denial rate to a 10% denial rate. Okay, why? Well, we dug into it. There's a specific CPT code that went from never being denied to being consistently denied. Okay, why? Well, they changed the billing direction from the payer that determines whether this code will be reimbursed or not. And there we've gone from like a very high level insight of like, yes, our denial rate is increasing, to something that is tactically relevant for someone to be able to change. So we need to be able to go from not just, hey, we're presenting like KPIs. It is, we're presenting KPIs in a framework that allows users of the data to be able to answer their questions and be able to peel back, not only, test their hypothesis, but be able to discover insights that they didn't know. If someone is interacting with data and they don't walk away from it and know the next like 3 conversations that they need to have, or they know I need to make a phone call to so-and-so in order to get something changed or fixed, then our data hasn't done much to drive an improved outcome, whether that improved outcome is clinical or operational or financial in nature. We got to be able to answer the why to the point where we get to something that is a nugget of information that drives a decision.
Oh, okay. So the 5 whys help you and your team to drive the decision.
Yeah, it helps us think about things from a data consumer's perspective.
Wow. Great logic and rationale. So next is a rapid fire, Kevin.
Okay.
And it needs to be instant. The responses needs to be instant. So can we go for it?
Okay.
Okay. One word to describe working in healthcare analytics?
Exciting.
A skill every BI professional should build outside of tech?
Learn how to communicate. If you are the most brilliant analyst, but you can't communicate your ideas clearly, you'll never succeed.
Best advice you have ever received in your career?
It doesn't matter how right you are if you leave people feeling like they've been wronged.
Oh, that's a nice one. One thing that makes work feel meaningful to you?
The aha moments when I'm sitting either in a clinical setting or an operational setting and I see the light bulb moment, that is what gives my work meaning.
If BI were a superpower, what would it be?
So I think about Doctor Strange, and Doctor Strange has the ability to go through multiple scenarios and pick the best or most favorable one. That would be the superpowers. Analytics gives us the ability to be able to test different scenarios and determine the one that's most beneficial.
Wow. What excites you most about the future of BI at IKS Health?
Our continued growth, particularly as a platform. So as we move away from standalone, maybe point engagements, or focus more towards platform opportunities and the data platform that's needed to be able to support that, we will be doing something that is beyond innovative in the space.
Great. Awesome, Kevin. Thank you. Thank you for sharing your insights and experiences with us today, from data driving to decisions. Data-driving decisions. It's been a great conversation on how business intelligence is shaping smarter decision-making and driving impact across organizations. I hope you have enjoyed being part of the session, Kevin.
Yeah, thank you. I've enjoyed the discussion and the insightful questions.
Thank you. And thank you to everyone who tuned into this episode of TuneIn. We hope you found the discussion valuable. Stay tuned for our next episode, where we'll continue exploring new ideas and perspectives. Until then, take care and see you soon.